Hello everyone, myself Sakshi Pal, a student of second year of Bachelor of Physiotherapy. Today we'll be discussing our topic of pharmacology. The name of the topic is anabolic steroid. So before we start discussing about anabolic steroid, first let us understand what is the use of steroid. Basically, steroids are a form of drug which shows many different effects on our body, and basically the term steroid are used for mainly two types. First one is corticosteroids and the other one is anabolic steroids. Corticosteroids are generally used as medication for inflammation and to treat certain allergic conditions or reactions such as asthma, eczema, etc. The example of corticosteroids is hydrocortisone. However, anabolic steroids are synthetic form of male androgen, which is testosterone. It is also used in certain medical conditions, but it is oftentimes misused by the individual to enhance their performances in sports. Now we will look at the anabolic steroids in detail. First, the introduction. As we discussed, they are synthetic derivatives of male sex hormone testosterone. They possess both anabolic effect and androgenic effect. In anabolic effect, they promote protein synthesis and help in muscle repair. However, in androgenic effect, they help in development of secondary male sexual characteristics. Classification. Basically, the anabolic steroids are classified in two types. First one is natural androgen, which is testosterone, which is produced naturally by the male human body. Next one is synthetic anabolic steroid, which includes nandrolone, stanozolol, oxandrolone, methendrinone, and oxymetholone. Now we will see how the steroids act on our body, or what is their mechanism of action. So basically, first they exert their effects by acting on androgen receptor inside the target cell. The first step is entry into the cell. Since androgens are lipid soluble, they enter and diffuse through the cell membrane very easily. Next one is binding to androgen receptor inside the cytoplasm. They bind to specific intracellular androgen receptors. Next one, third step is formation of steroid receptor complex. Fourth step is migration to nucleus. Basically, the complex form enters the nucleus and binds to DNA. When this binds to DNA, it initiates gene activation. When the complex binds to DNA and stimulates transcription of specific genes. The last step is increased protein synthesis, where more mRNA is produced. And now the physiological effects. Are the effects caused by these steroids? First one is increased muscle mass, increased bone growth, and increase in erythropoiesis, which is RBC production. Now we'll look at the therapeutic effects. The therapeutic effects, the first one is male hypogonadism, used as replacement therapy when testosterone levels are very low in male. Second one is delayed puberty, as anabolic steroid also help in development of secondary sexual characteristics in male, which is deepening of voice, facial hair growth. Next is muscle wasting disorder. It is also used in conditions such as HIV and AIDS. Next, HIV, AIDS, and cancer. Next one is severe burns and trauma. Since it helps in tissue healing and muscle repairs, it is also used in conditions of burns. Fifth one is certain types of anemia. Since it helps in erythropoiesis, it is also used in anemic conditions. Pharmacological effects. It produces many pharmacological effects on different systems of our body. The first one is musculoskeletal system. On musculoskeletal system, it increases muscle mass and strength. It increases muscle size. It helps to increase bone density, and it helps to increase muscle repair. Next is on hematopoietic system, which it helps in erythropoiesis. And third one is on reproductive system, which is development of male secondary sexual characteristics. Now we'll see the general effects of anabolic steroids, which are development of acne, having hypertension, severe mood swings, increased cardiovascular risk, increased aggression, edema, and liver toxicity. If this is taken in more amount than needed, then it can cause liver toxicity. The contraindications are prostate cancer, severe liver disease, breast cancer in males, severe cardiac disease, and pregnancy. It is avoided in pregnancy. Now, since we discussed earlier, anabolic steroids are often misused by the athletes to enhance their performances in sports. Athletes may misuse anabolic steroids to increase muscle mass, improve strength, and improve performances. But there are certain and several risks of this abuse. First one is hormonal imbalance, liver damage, cardiovascular disease, psychological disturbances, and addiction. Use of anabolic steroids for performance enhancement is prohibited by world anti-doping agencies. Next, we'll look at the adverse effects of anabolic steroids. Basically, the adverse effects when it is taken by males, it produces testicular atrophy, it lowers the sperm count, it causes infertility and gynecomastia, which is enlargement of breast in males. In females, it causes deepening of voice, menstrual irregularity, and masculinization in females. In adolescents, it can cause stunted growth.